www.healthcmi.com. Today, acupuncture improves pregnancy rates. This was published August 19th, 2019. Let's take a look. Acupuncture boosts clinical pregnancy rates and balances biochemistry in infertility patients with a thin endometrium. First Affiliated Hospital of Xinjiang Medical University researchers combined acupuncture with standard drug therapy. They determined that acupuncture plus estradiol drug therapy produced superior patient outcomes. So what happened was patients only receiving estradiol hormone therapy had a 20% clinical pregnancy rate, but when you added acupuncture into the protocol, that jumped to 33.3% clinical pregnancy rate. Now, this is very specific for people with endometrium thickness issues. Now, what's interesting is the research goes deeper and it measures resistance index, pulsatility index, endometrium thickness, and morphology. It goes into the details, into the anatomy and physiology, into the biochemistry on a very deep level. So not only does it measure an increase in successful pregnancies, but also the overall health of the patient. So this is very interesting. It does outline the exact acupuncture points used, how it was done, and when it was discontinued as a treatment form. I'm looking at the long list. There's a lot of acupuncture points that can be used in this study. Now, some of them are very common, Zigong, Shui Hai, which is spleen 10. But we'll also see some others we may not expect. How about GB26 Dai Mai? We know that's good for treatment of infertility and good for the uterus, but there it is being used. CV6 Qi Hai, and many more. So go to healthcmi.com, click on news, take a look at this article. I think you'll find it very interesting. You'll see the results, and you can judge for yourself. This looks like very solid research. It looks like they're using core acupuncture points, which are consistent with most of the research we review here. So I like this study. It is rather generous with the acupuncture points, more than usual. If I take a closer look, it does look like patients on both the control group and the treatment group did have 2 milligrams of estradiol on the third day of the menstrual cycle, starting on that 2 times daily. Again, but only one group received the acupuncture. Now, the drug treatment stopped on the day of the luteinizing hormone peak. So it gives all the parameters, how this was done, how the results were achieved, even the acupuncture techniques, including the Pingbu Pingxie technique, the mild reinforcing and reducing techniques, how the needling was applied. A little bit of moxa was here also, so that's also very interesting. So moxibustion was left in place on needle handles to self-extinguish, and they used 3 cuttings of moxa per needle, so very warming treatment. So again, go to HealthCMI, click on News, and then look for the article entitled Acupuncture Improves Pregnancy Rates. Thank you for listening. www.healthcmi.com.